Hi viewers, today let's try and understand endocrine testing for short stature, GH versus IGF-1. So you all know that GH is called growth hormone. It's actually produced from the pituitary gland under the influence of something called growth hormone releasing hormone and various other mediators. For example, stress, sleep, all these things also release growth hormone. And the growth hormone is actually released from the hypothalamus. From the hypothalamus, you have the pituitary gland like this, okay, and the pituitary gland produces growth hormone, and the growth hormone actually goes and acts on your liver, okay, liver to produce IGF-1. In addition to the liver, growth hormone acts in various other target organs also. Growth hormone directly acts on the bone, alright. So growth hormone production is typically pulsatile because it requires something called a releasing hormone. Okay, releasing hormone is not produced at all times. There are specific triggers which are required. So growth hormone levels are not high all times. So when you are looking at short stature diagnosis, so a random growth hormone, random level of growth hormone done only once has no value. Okay, so you may do in a child who is absolutely normally and growing well. So if you do a random growth hormone, the random growth hormone may come low, or even a fasting level of growth hormone may come low because growth hormone is produced at night. Okay, at night is when it's produced. Under stress, it's produced more. Okay, so we do something called a stimulation test. Stimulation test is when we push the growth hormone out of this using various stimulation tests. One stimulation test is using clonidine, which we use commonly. We can use insulin-induced hypoglycemia as a stimulation test, right? So these are stimulation tests for the growth hormone production. But apart from that, the best way to actually assess growth is to do a random IGF-1. Random IGF-1. You can do it in the fasting state. Typically, it is done in the fasting state. The IGF-1. IGF-1 is called insulin-like growth factor 1. So the IGF-1 level, if it is normal or high, it rules out a growth hormone deficiency. If it is in the normal range, typically growth hormone deficiency is ruled out. But if the IGF-1 is low, then it could be due to other conditions like nutritional disorders. So, for example, someone has celiac disease, so their growth hormone may be high, but the IGF-1 may be low. Or someone may have kidney disease, or someone may have Turner syndrome. Then again, the IGF-1 will be low and the growth hormone may be less. So many of these complex interactions are there. So typically, we measure a random IGF-1 or a stimulated GH rather than just the GH alone, So typically in clinical practice, what I do is when a child presents with short stature, there is no apparent cause for growth failure. So I will usually get a IGF-1 level. So IGF-1 level is sort of a screening test, and if the IGF-1 level is normal or high normal, so then it more or less rules out growth hormone deficiency. But IGF-1 normal does not mean that you cannot give growth hormone. Okay, so there are several indications for giving growth hormone. Even the IGF-1 level may be normal, but if there is a idiopathic short stature, we can give growth hormone. If there is a small for gestational age and the child has not kept up with growth, so some child with short stature or a small at birth, say instead of 2.5 kilogram normal birth weight, the baby is born with say 2 kilogram birth weight, the height is not picking up, then again we can give growth hormone therapy. Even in Turner syndrome, despite the GH and IGF-1 being normal, we can give growth hormone therapy. In children with chronic kidney disease, despite the growth hormone and IGF-1 being normal, so we can give growth hormone therapy. So these are some of the indications for growth hormone therapy. But to diagnose what is the actual cause, so we use a random or a fasting IGF-1 level, compare it to the age-matched levels, and we do a stimulated growth hormone. Okay, so the exact opposite happens when you are actually looking at acromegaly. So for acromegaly, what we typically do is we do a random GH and IGF-1. If the GH and IGF-1 both are high, if the IGF-1 is high and GH is inappropriately normal or high, so typically the IGF-1 is high, GH should be low because of the feedback inhibition. So the IGF-1 actually suppresses GH. So if you have a slightly high GH and IGF-1, it indicates a growth hormone excess condition. So a random GH and IGF-1 can be used to diagnose acromegaly, which is the opposite of growth hormone deficiency. It's a growth hormone excess condition. Thank you.